Tonight, I want to talk about something most people never think about. What you do in the evening can affect your heart while you sleep. A lot of serious cardiac events happen in the early morning hours, often because the body naturally changes overnight. Blood pressure, hormones, hydration, breathing, and circulation all shift while you're asleep. And for older adults, especially anyone with high blood pressure, diabetes, sleep apnea, or known heart disease, those shifts can matter. This video is not medical advice, it's education. If you have a heart condition or take prescription medication, don't change anything without talking to your clinician, because timing and dosing can be different for different people. With that said, I'm going to walk you through 7 common nighttime habits that can increase cardiovascular strain, plus simple changes you can start considering tonight. Let's begin. Habit 7. Taking blood pressure medication at the wrong time. Many people with hypertension take their medication in the morning simply because that's what they were told years ago. But the body doesn't have office hours. Your blood pressure follows a 24-hour rhythm, and for many people, it rises sharply in the early morning. Some research suggests that for certain patients and certain medication types, evening or bedtime dosing may improve overnight control. Other studies are mixed, and for some people, bedtime dosing can cause low blood pressure at night, dizziness, or falls. So it's not a one-size-fits-all rule. Here's the practical, safe takeaway. If you take blood pressure medication, ask your doctor or pharmacist whether your current timing matches your blood pressure pattern. If you've never done it, ask about home blood pressure tracking at different times of day or 24-hour monitoring to see your real pattern. Never change the timing on your own if you take multiple medications, diuretics, or if you've had fainting, falls, kidney issues, or heart rhythm problems. This one isn't about secret tricks. It's about your body's clock, and the best plan is personalized. Habit 6. Sitting for long stretches in the evening. This one is incredibly common. Dinner is done, you sit down, and suddenly it's bedtime. When you sit still for hours, blood flow in the legs slows down. In older adults, reduced circulation plus existing risk factors can increase the chance of clotting problems and can also raise overall cardiovascular strain. You do not need a workout, you just need interruptions. Try this. Set a timer for every 30 minutes during evening TV or screen time. When it goes off, stand up for 60 seconds. Walk to the kitchen, stretch gently, march in place, or do a slow lap around the room. If standing is hard, do seated ankle pumps, flex and point your feet 20-30 times, or tighten and release your calves. This is simple, free, and realistic. Tiny movement breaks can help circulation and can also improve sleep quality. Habit 5. High sodium dinners close to bedtime. Sodium isn't evil, but timing can matter, especially if you already have high blood pressure. A very salty dinner can cause fluid retention and increase blood pressure. And when you lie down, fluid shifts in the body can change how your heart and lungs feel overnight. For some people, it can worsen nighttime blood pressure and even make breathing harder, especially if they have sleep apnea or heart failure. Practical steps. If possible, make dinner your lighter, lower sodium meal of the day. Aim to finish heavy meals at least 3 hours before bed. Watch the sneaky sodium sources: canned soups, frozen meals, deli meats, sauces, takeout, and restaurant food. If you rely on packaged meals, look for options with lower sodium and add fresh sides like vegetables or fruit. You don't need perfection. Just reduce the salt bomb dinners right before sleep. Habit 4. Alcohol too close to bedtime, especially with sleep medications. Alcohol can make you feel sleepy at first, but it often worsens sleep quality later. It can increase snoring, worsen sleep apnea, and trigger nighttime awakenings. It can also affect heart rhythm and blood pressure, particularly in people who are sensitive to it. And this is the most important part. Alcohol and sleep medications do not mix safely. That includes prescription sleep aids, some anxiety medications, and even certain over-the-counter PM products. A safer approach. If you drink, try to keep your last drink at least 4 hours before bedtime. Avoid alcohol entirely on nights you use any sedating medication unless your prescribing clinician has specifically advised otherwise. If you rely on alcohol to fall asleep, treat that as a sign to look for a better long-term sleep plan, because alcohol-based sleep usually gets worse over time. Now let's move to habit 3, because it's one of the most misunderstood. Habit 3. Going to bed dehydrated. A lot of adults, especially older adults, stop drinking fluids after dinner because they want to avoid waking up to use the bathroom. That makes sense, but it can backfire. Dehydration can thicken the blood slightly and increase strain on circulation. And for people with certain risks, dehydration can contribute to headaches, dizziness, constipation, and even palpitations. The goal is smart timing, not drink nothing. Try this hydration strategy. Drink most of your water earlier in the day. Aim for steady intake from morning through late afternoon. About 90 minutes before bed, have a small glass, something like 4 to 6 ounces, then use the bathroom right before you lie down. Check your morning urine color. Pale yellow usually means you're reasonably hydrated. If nighttime urination is extreme or sudden, don't just restrict water. Ask a clinician because causes can include sleep apnea, bladder issues, prostate enlargement, diabetes, or certain medications. Habit 2, a sleep setup that increases strain. This one isn't about fear. It's about comfort, breathing, and circulation. For many people, a poor sleeping position or low-quality pillow support can worsen snoring and sleep apnea, reflux, neck strain, and poor sleep quality overall. And poor sleep quality affects blood pressure, inflammation, and stress hormones. The safest, most practical guidance is if you snore, have reflux, or wake up breathless, try slight head elevation. Use a pillow setup that keeps your neck neutral, not twisted sharply. If side sleeping is comfortable for you, use a pillow between the knees to reduce hip and back strain. There isn't one magic side for everyone. What matters most is breathing well, sleeping deeply, and staying comfortable so you don't toss, turn, and stress your system. If you suspect sleep apnea, loud snoring, choking sounds, morning headaches, daytime fatigue, get evaluated. Treating sleep apnea can reduce cardiac strain dramatically. Habit 1, taking sedating over-the-counter PM medications regularly. This is the big one because it's common and misunderstood. Many over-the-counter sleep aids and PM pain relievers contain first-generation antihistamines like diphenhydramine or doxylamine. These can cause next-day grogginess, confusion, dry mouth, constipation, and, especially in older adults, higher risk of falls. They can also affect heart rhythm in vulnerable people and may interact with other medications. This is why many geriatric safety guidelines recommend avoiding these products for routine sleep, especially after age 60-65, unless a clinician specifically says it's appropriate. If you're using PM products to sleep more than occasionally, consider this safer path. Talk to your clinician or pharmacist and review what you're taking. Ask about non-sedating alternatives for allergies, pain, or insomnia, depending on the real cause. Consider sleep basics that actually work over time. Consistent sleep and wake time. Cooler room temperature. Dark room and reduced evening screen brightness. Caffeine cutoff earlier in the day. Morning daylight exposure. And gentle activity during the day. If you take prescription sleep medication, don't stop suddenly without guidance. The safer approach is a plan. Sometimes tapering, sometimes switching, sometimes sleep therapy. A simple tonight plan you can follow. Let's put all 7 habits into a calm, realistic checklist. 1. Medication check. If you take blood pressure meds, ask your clinician if timing matters for you. Don't change it alone. 2. Movement breaks. Every 30 minutes in the evening, stand up for 60 seconds. 3. Dinner timing. Finish heavy meals 3 hours before bed when possible. 4. Lower sodium dinners. Watch soups, frozen meals, deli meats, takeout. 5. Alcohol buffer. Keep alcohol 4+. Hours away from bedtime, and don't mix with sedating meds. 6. Hydration timing. Drink earlier, small water, 90 minutes before bed if needed. 7. Sleep setup. Optimize breathing and comfort. Consider evaluation for sleep apnea if symptoms fit. None of this is about panic. It's about stacking small advantages. If you're over 60 or you care for someone who is, choose one change tonight, not all 7. The best plan is the one you can actually keep. And if you want the most powerful next step, it's this. Bring your medication list to your pharmacist or doctor and ask for a full review. Timing, interactions, and sleep safety. That single conversation can prevent a lot of problems. Thanks for watching, and take care of your heart, especially at night.